Good afternoon. Thank you for joining us for our weekly COVID call. Um, we've got about 50 on so far, and more will be joining us as we go on. Want to encourage all of you who, if you haven't done so, to register for our virtual conference. Um, for those of you wondering why you're feeling a little out of sorts this week, it's because this is the week we would have had our annual conference and a chance to get together with your peers around the state. So we're going to try and recreate that virtually this week. So Thursday, make sure you register. In the chat box is the registration form. So I want to make sure that you register and you get your colleagues at your various communities to register as well. Great opportunity. We're going to have a keynote speaker. We're going to have some of our business partners who are going to give short presentations on how to deal with COVID-19. We've got a town hall meeting with some folks from LeadingAge National. And we're also going to try something different, a virtual happy hour. So chance to just mingle with your peers again. So make sure you register this week or register today for this Thursday afternoon. We're really pleased today to have Danny Mack on as our speaker today. And he's going to talk about the loss of community during the COVID-19 pandemic. So I'm going to introduce Danny. Danny is the Director of Spiritual and Social Services at Christian Care Communities and Services. He is a proud graduate of the LeadingAge Leadership Institute. And Danny is a philosopher, theologian, motivational speaker, spiritual healer, and of course, an expert in rock and roll. So Danny, take it away.
Okay, thank you. Well, I'm so glad to be able to be with you guys and speak with you. As George said, I'm going to talk to you about the loss of community during the COVID-19 pandemic. And one of the things, whenever this all began, I realized I was having these underlying feelings. I was at home, I was doing my work on my computer. I had plenty of food. If I needed food, it could be delivered right to my door. I had my television that has all the TV channels I could ever watch. There was really no problem. I just had to be at home. But underneath that was a feeling of anxiety, sort of a feeling of dread and of uncertainty. And what I realized is that the feeling I was having was the feeling of grief. And I think it helps to name the feeling we've been having, to name it grief, and to realize that what we are experiencing is grieving the way we've been living before. We've had significant losses. So I'm going to explain that to you today. The first thing I want you to see is that we're living in the unworld of COVID-19. So think about it. You were living in the world you were living. You were doing what you were doing. You had the way you got up in the morning. You went to work. You did what you did at work. You came home. You had your family life. You were living your life the way you did just about every single day. And then suddenly everything changed. Everything changed in a moment. And suddenly you were placed into an unworld, a world we've never been in before, a world where we don't know what's going to come next. And some of the terminology people are using is that we're going to have a new normal. And that term new normal is what's used in grief counseling when you're helping someone after a death begin to redo their life and beginning to get their life back together again. It's a new normal that you have to create. And so we're living in this unworld that we're going through until the time we come into the new world. Well, we don't know what that new world is yet. We're going to have to travel through the unworld of COVID-19. And as we travel through it, we can't get around it. We can't go over it. We can't go under it. We can't make it go faster. It's going the pace that it's going no matter what we do. We're in this unworld, and we need to understand that being in a world you've never been in before, it's okay to grieve the way the old world was, to grieve the way you were trained, to how to run business, the way you understood how to do your family, the way you understood how to do your personal life. All those things may not be fitting into this unworld in a very good way for you. Then there's what's the loss of predictability. We have predictability that we have in our lives. It's the things we do. I bet when you go to work, you have a way that you enter into your office. There's things you get together, things you check first as you go through the day. As you leave, there's a predictable way of you going about the habits that you have. You leave the office and then you go home. There's predictability. Like my wife and I, we watch Survivor every Wednesday. We have pizza and we watch Survivor because we like it so much, because I pastored a church and Survivor is so much like church. There's people talking about behind you, behind your back, and trying to do you in, and then the tribe is spoken and they vote you out. I hope you're laughing. I see it's, if you were audience, I hear huge laughter at this point. And so loss of predictability. What are we going to be doing? That we have the habits that we have every day, and we've lost that predictability. So we can't predict what's going to happen. What are we going to do tomorrow? What's tomorrow going to be like? We don't know what tomorrow. We don't know what next week, next month. We just don't know. And then there's the loss of relationships. People have lost relationship with their families. People in your communities, families are not able to visit their loved ones. Loved one could be going through a very big health crisis. Even they could be dying and they're not able to go see them. And so I was talking to a lady just this week, and she was thinking about putting her mom in a facility, but she didn't want to do it. So she's going to have to make a decision to stay at home, because if she puts her in a facility, she won't be able to come see her. And of course, for our hospice, that's great, because we're able to go to her home and provide that care that she needs. And so there's loss of relationships. My grandchildren have had drive-by birthdays, and the grandchildren do not think that's as good as a regular birthday party. And the anniversaries have taken place. I have friends who had a 50-year anniversary party alone in their house. They weren't able to go anywhere. Vacations have been canceled. I'm going to be off next week, and there's no place to really go to now. And so there's the loss of relationships. And then there's the loss of innocence. There's a loss of innocence because we're living in a world where we think that bad things don't happen to us. It seems like all the bad things happen to other people. And so we lost the innocence that there's people around us dying. And so you started getting reports every day of the number of people who have the virus and the number of people who have died. And so we live in a world that's death denying. And so whenever we see these numbers in our face, then we begin to lose our innocence that death could come knocking on my door or somebody that I love. So just suppose every day we saw the number of people who died from automobile accidents or alcohol-related accidents, the number of people who died from cancer, heart disease. Every day there was the countdown. What if you're checking on your app to find out what the numbers are for today? See, just having those numbers of the coronavirus in your face causes you to have a loss of innocence. And then there's the shattering of the dominant paradigm that takes place. We have a dominant paradigm of the way that senior living communities are supposed to operate. This is the way we've been doing it for years. I was talking to George about how at conferences, last few we've been talking about thinking out of the box. We suddenly got dumped out of the box. Now we totally got dumped out of the box, and it shattered our dominant paradigm. So let me give you an illustration of like a video game. Suppose a video game and you're on level 1, and you go through level 1, and there's obstacles and there's things you have to overcome. And you go through level 1 and you go through it and you try to get all the way through level 1, and sometimes you don't make it. but you try it over again and you go through, and finally you get to where you can go through level 1. In fact, you can go through level 1 very fast now. Then you get moved up to level 2. Then you go through level 2, there's new trials, there's new tribulations, there's new obstacles. But after you've worked on level 2 for a while, you're able to get through it. Then you move up to level 3. And so what's happened is, if you think of it like a video game, we've been on a level in which we have been working and handling the business that we have and the relationships that we have. And suddenly we have been moved to the next level. And as we move to the next level, we have trials and tribulations, we have obstacles ahead of us that we're not sure what they are, but we're going to have to overcome them as we go through the next level. So there's the shattering of our dominant paradigm. The way we've done it in the past may not be the way we do it in the new normal. And then there's the waves of reality. And so is the reality sweeps in waves where we have some form of denial. I'm sure all of you thought, I think I'll go and visit, and so suddenly you realize you can't go do that, or you're going to go visit a part of your campus that you're not allowed to go into right now. And you suddenly realize that the reality is things are changing. You didn't want them to change, but they are changing. And it comes in waves. You have days where you feel like it's going to be all right. You know, I realize I have had days where I'm thinking I'm walking in the peace of the Lord. Then I have some days in which I say, don't mess with me or I'll cut you. I have these different moods that I go through. So the reality of what's happening happens in waves. And so you experience those waves. And so, George, if we'll go to the next slide, I'll show you what to do when you don't know what to do. So when you're in the midst of a huge paradigm shift, what do? First thing, you have to admit that you don't know what to do. And it's okay to admit that. Every leader, every CEO, every person who has any leadership position has times in their life where they don't know what to do. And it's best to just admit that to yourself. I don't know what to do. And when you do that, it opens you up for the possibilities of new things that could happen, that you could create new paradigms. You could have more creativity if you just realize you don't know what to do. Some of the methods of the past aren't working in the present. And then do what you know to do. There are things you know to do. And one of the things that happens in sports is whenever a team is struggling, they don't work on their complicated plays. They go back to fundamentals. And when you don't know what to do and you're trying to figure things out, always look to the fundamentals. And most of the time when we're making mistakes and we're not doing the best thing for ourselves is because we're ignoring the fundamentals. For you as a person, you have to get exercise, you have to have nutrition, and you have to have sleep in order for your body to run. And it doesn't matter if the COVID-19 is going on or not. Those are fundamentals for your life. There's fundamentals in business, there's fundamentals in family. You have to be looking at the fundamentals. Then ask someone who does know what to do. Now, I've been through a pandemic before, and you can't call them up and find out how they handled it, but you all are interacting with one another, and you can find out how each one of you is handling it and how you can get some ideas about what to do. But it's also good to talk to somebody who's been through financial crisis. Talk to somebody who's had business failure. Talk to somebody who's gone through really hard times. And person, ask them, how did you get through the hard times? And then the fourth thing is don't catastrophize the future. Our mind is created to protect us. And one of the things we do when we look at the future, we tend to catastrophize it. And so what we're doing when we're catastrophizing the future, we're just using our imagination. And so when you catch yourself catastrophizing the future, how bad it's going to be, take that as an opportunity to be able to catch yourself and begin to reimagine the future. Here's what I know about the future. In the future, there's going to be unlimited possibilities. There's going to be unlimited opportunities. There's going to be opportunities that are going to come that we Imagine what they are. They may not even exist yet, but there's going to be opportunities that are going to come our way. There's going to be new relationships that are going to come our way. People are going to come into our lives who are going to make it more meaningful and more beneficial for us, and we haven't even met them yet. So I guarantee you there are new possibilities coming ahead. There's new relationships that are coming for you. And so begin to imagine the future of unlimited possibilities, things you've never thought of before. And then the fifth thing is you can only do what you can do today. And so just try to focus on today. Today is the only thing you have control of. And so when you're going through a season of not knowing exactly what to do, you're going to go through it one day at a time. Try to focus on what you have to do today, get through, make good decisions for today, because things are going to change maybe tomorrow. So do what you can do today. Be at peace with yourself today. One of the things I do, I'll show you my hands. When I come into my office each day, I do this. I said, this is the past and this is the future. And I bring them together and I say, don't live in the past. I can't live in the future. I only have right here, right now. This is the only place I am. This is the only thing that's going on in my life. And I try to have my brain and my breath and my butt all in the same place at one time. This is where I am right here. And that's the only place I can have control in my life. So as we go through the loss of community, first to see it as a grieving process. It's a process of letting go of the past. It's a process of re-engaging with the future. It's the process of staying in today and allowing ourselves to feel our feelings and to take one day at a time. Anybody have any questions or comments?
Yeah, if you have questions, please post them in the chat. Or if you want to unmute yourself, you can do that too.
I would just say, Danny, those are great things for all of us to remember. And we get in these crisis moments where it's hard to breathe, but that certainly, if we can remember those steps, is very important information. Thank you for sharing.
Thank you. It is when we're in crisis, we start breathing more shallow. And so it's good to catch yourself, to take deep breaths, just try to stay in the moment. And here's one thing about the future. I don't know what the future is going to look like, but it will be different. But here's the thing. It will be good again. It's going to be good again. It's just going to be different. So I have total faith in that it will be good. It's just different.
Danny, are there specific things that you would, I guess, encourage people to tell their coworkers, their staff, their just people they're around to, to help them cope with these times?
I think the best thing that you can do with staff is to listen. And you may have to set up opportunities for them to speak honestly, because they don't want to disappoint you. They don't want to let you know perhaps that they have some kind of weakness. They may see that as not wanting to be vulnerable to their employer. So you have to set up the situation where maybe you're somewhat vulnerable, and that allows them to share what they're feeling and to just encourage them. It's okay to not know what to do. And if you feel comfortable enough to admit, there are times I don't know what to do myself. I have to rely on what other people are saying and other experts, and give them permission to share their feelings, and let them know we're going through a process, and all of us are going through it together. So I think sharing those feelings, sometimes leadership can try to stay separated. So maybe even an opportunity to redefine your culture. You haven't had a culture in your organization where people feel open to communicate. Use this as an opportunity to do that, and it can project you into a different kind of relationship between employer and employee.
Just in terms of, when people go through a traumatic time together, um, it sometimes brings people really close together as teammates. Um, do you see that this is an opportunity for that as well?
Yeah, it is, and it's a challenge because more people are working from home, and so the feeling of a team is not as easy as uh, when you're separated like that. I think it's a challenge actually for developing the team atmosphere. So I don't know. Let me hear what you guys have to say. I do a lot of Zoom meetings. Uh, I don't particularly like Zoom compared to being in person. It's not the same, right? And for me, what makes it not the same is all of you are looking at me, right? And if we were in a room, you might be looking at me standing up in front of the group, but I wouldn't be focused on you. You're all looking at me. And then how can you have discussion? You start talking over one another. There's the discussion that happens before the meeting, right? When you're coming into the room, and then there's after the meeting. So I'd be interested in hearing your feedback. Do you think what's happening helps for building team or separate? What do you guys think?
I'll just share, when you're the leader, as the executive director or as the administrator or the person in charge, you're used to being the last one, to answer all the questions. You're supposed to have the answers. People look to you to lead them. And this is a time when we don't have all the answers, and it's an opportunity to be vulnerable. But I think it's also an opportunity to spotlight those people that do have the answers, like you were putting in your presentation, because we can bring in experts, and I think that actually helps to build teamwork. You're broadening your base. You're bringing in people who know things that you don't, and I think that one, people appreciate that, and two, it helps you grow your team.
Absolutely. One of the dynamics that happens in grief groups, when I do grief support groups, is that there's about 10 or 12 people in a group, and they all have their feelings. Suddenly, as everyone begins to share their feelings, here's the first thing that someone says. It'll happen every time in the first group. You mean I'm not going? This is what everybody's feeling. So it normalizes the feelings that people are having, to just realize there's some things I don't know, and I'm learning as we go along. And I really appreciate you pointing that out from the presentation, that bringing people who have been through crisis and know how to explain to people how to manage your life as you're going through a crisis is very helpful. And here's the thing, we're all going to experience crisis in our life. And so it's good to have something in our toolbox on how we can go about handling it. So do y'all like Zoom meetings? Do you find it, here's the thing, if you have a choice, being in person or doing it on Zoom, which do you like best?
No doubt in person, Danny, no doubt in person. But with everybody who can't be together, Zoom is the only way, Zoom and FaceTime. And you and I, we all know that we have some residents who never see their families or rarely see their families, but all of a sudden they're seeing them. So the blessing, if we look for the blessings, like you've told me before, look for the blessings. Look at the residents who are connecting with their families who haven't before, and the good that's come out of this bad.
Yeah, see Zoom as a tool, right? It's one of the tools we have in our toolbox. And during this time, we're able to pull out Zoom and use it. So it's just not as good as in person. You guys are a great group. So is there anything else I could answer any questions for you? If not, I'm going to turn it back over to George.
All right. Thank you, Danny. I really
You're welcome.
appreciate it. This is great, great talk and really hits home because hits home with everyone. This just not knowing what to do and just sort of taking it day by day and moment by moment, really. So thank you for reminding us how important that is. So I'm going to turn it over for a regulatory update to Elise. Are you ready? You're on mute.
Hi, everyone. Sorry about that. Nice
Okay.
to see everyone's faces. Hope you're doing well. Thank you, Danny. I needed that. That was perfect timing for this day. So that was great. We appreciate you taking the time today to lift our spirits a bit. Wanted to provide a few updates to the group. First, I just wanted to touch on the CMS memo released to states yesterday regarding the development of reopening plans for nursing facilities. We had a phone call with HHSC this morning to get their initial reaction and response to this memo and an idea of what development and implementation will look like. HHSC will be overseeing the development of a plan for Texas nursing facilities to reopen. If you haven't had a chance to see the memo, there are several criteria that would need to be met prior to reopening or even moving into a phase where visitation was allowed. This development will be ongoing. It will need to be approved by several agencies as well as the governor. It will need to go into Texas administrative code, so emergency rule will need to be drafted, and this will be long-term because there will be some impacts on the regulatory side that will be ongoing, but also some time to develop guidance for providers. We requested that HHSC put a communication out to providers within the next 24 hours, just acknowledging the CMS memo, but also to reassure you all that this is not something that will be implemented tomorrow, and wanted to give you a tool to use as you communicate with families and residents' loved ones, because we assume, some may see this memo and interpret it to mean they're allowed to visit their loved one, but that is indeed not the case. So want to provide you with a tool to communicate with residents and families. So we'll be pushing that out as soon as it's approved and developed by HHSC. One other item I'd like to touch on is related to reimbursement for conducting your own testing under the governor's directive. If you've had a chance to look at the FAQs developed by HHSC for providers who have elected to conduct their own testing, there is some language there that references reimbursement opportunities for providers. Those reimbursement details are in process, and we anticipate receiving an update from the agency this week on how those providers will be reimbursed, what that will look like, what will be covered if you do choose to conduct your own testing. The assisted living facility COVID response plan was just updated and sent out yesterday. They reformatted it per our request. We asked that it look more similar to the nursing facility response plan, and it includes some additional resources that were not there before but should be helpful to assisted living providers. Also related to COVID-19 reporting, DSHS has posted outbreaks in long-term care facilities by region. I can post that on the resource page if it's not already. I believe I sent it out to main contacts over the weekend. But this shows in real time the number of confirmed outbreaks per region. I'll put the link actually while we're talking. I can't do two things at once, sorry. So that is a new resource. We're still being assured that individual facilities will not be publicly posted, although we know CMS will start reporting this data, and you've finished your first reporting requirement for the CDC COVID-19 module. The assisted living facility and nursing facility webinars hosted by HHSC are ongoing. ALs are on Wednesday, nursing facilities are on Friday, so I encourage you to continue joining those calls, continue to register, continue to ask questions. And then the last resource I thought was actually helpful that was sent out yesterday, I believe, was the May 2020 Quality Monitoring Program memo or bulletin. It contains several resources, quick links for providers. So want to make sure that you've taken the time to look at that and bookmark it because it's a nice quick reference of some of the more important resources that HHSC and CMS have put forward. We will be sending a letter today on behalf of LeadingAge Texas and Texas Healthcare Association urging the Legislative Budget Board to approve the Medicaid supplemental funding request by HHSC. This appropriation would, the ask was to go toward increased staff wages and increased expenditures for PPE and dietary. So we're hoping that that is approved within the week. It's a total of $137 million, all funds, but is desperately needed, particularly for those communities that rely heavily on Medicaid. So we are really focusing on getting movement and approval on that. Those are the items I wanted to touch on. Happy to answer any questions related to the testing directive. Or anything else that we've mentioned or that you have on your mind, really.
I will say that I know that if you haven't been contacted already or haven't been tested already, I think every nursing facility in the state is supposed to be tested in the next couple of weeks. So we'd love to hear if you're experiencing any issues or need any information, let us know because we've already answered a lot of questions and fed a lot of questions up to the agency. So I just want to let you know we're a resource for that.
There's some questions here coming in. I'm happy to answer. Are other CCRCs testing campus-wide or just long-term care? I know as staff, we've heard that some communities are conducting testing of all levels of care, so I know that is happening.
But it's not mandated. The state is doing just nursing facilities. I think there was talk that they were doing possibly some assisted living if they're in the same building as a nursing facility, but not, and of course, independent living is not regulated, so they can't really force testing in that population.
Yeah, that's right. And I have heard that depending on where communities are and the capacity of tests in that particular location, some local health authorities have offered to test entire buildings. Based on what I know, that's happened in the more rural parts of the state, but it could be offered. And like George mentioned, if you are under the same roof where the local health authority feels it necessary to test the AL as they're testing for nursing facility residents, they're definitely able to do that.
Thank you. Hello. Yes, ma'am. Thank you.
There's a question here. What happens if an employee refuses the test? Will we have to pay them to be home during the 14-day self-isolation period? I believe it would depend on your paid time off policies. I don't know if Corey McDonald is on the line and has any insight there, but the state has not, mandated that they be paid. So the state has not touched on this issue whatsoever.
Hi, Elise. Yeah, I don't have anything to add at this point. I'm hoping there'll be some more guidance on, what specifically has to happen for those that, decline a test or test positive. I recall seeing something about 14-day quarantine. So yeah, I do think the first step would be looking at PTO policies, and seeing, verifying that you're not required to, pay PTO during that time based on anything in your PTO policy. After that, I would generally take the approach of making it clear to workers that if they decline and are forced to take time off, that it will not be covered. I think people should probably have that information in advance, and it may play a role in their decision.
Okay, thank you. A question, any update on Dallas County Judge and 30 clear requirement for readmission? So the 30 days applies to the date of diagnosis that we did receive clarification on. However, we are challenging another piece of that order related to the level of care that confirmed case occurs in. So as of yesterday, Dallas County stated that you cannot admit into any level of care, and the language clearly distinguishes level of care. So we did follow up on that and are asking for clarification and asking that they reconsider that interpretation. But in terms of the 30-day clear requirements, it's from the date of diagnosis. On our call this morning with HHSC, we asked about any preliminary results on the mandatory testing. They started testing in Harris County as of Saturday. They are working Harris County first. So if they started testing potentially Saturday, Sunday, we will probably start seeing results come in maybe today, but testing has just started. So with a 3 to 7 day turnaround, I'm hoping to have some initial reporting by the end of this week. I'm just scrolling through the questions. Are there any state resources that can help with employee testing? We can use local lab for residents. This is if we do our own testing. I don't know that there are any resources in terms of how to test your employees if you're going about it privately. I think it depends on, the lab that you're working with. It depends on whether your medical director will include your staff in their order. It depends on if you're paying out of pocket or billing staff insurance or asking staff to pay out of pocket. So I think there's several considerations there. But we can look for any resources. I can say there aren't any staff or state resources on that issue, but I'm happy to pose any questions you have to the agency.
Elise, I saw a question about conditioning, any legal problem with making testing a condition of employment. And I do think generally that would be a problem to require that as a condition of employment. The analysis I've seen about that in particular is under the ADA, Americans with Disabilities Act, and also some, privacy issues. I do, there's a carve out in the ADA for a scenario where someone's disability or condition presents a direct threat to other people. And in that scenario, and again, I'm speaking as a non-employment lawyer, but my understanding is in those scenarios, you can request information or take other steps that you might not otherwise take to protect other people. In this case, in particular, where the state is mandating it, I don't really know what the option is other than to give people some sort of opt-out where they can refuse the test and then not work for a period of time. But I also do think it's important to convey to employees and others and any kind of documentation you keep about this that, you're doing this because the state is making you and not because it's some sort of independent action, you're taking.
There are more questions on the Dallas County order. I think we answered those. If I missed something, type it in. Or I'm looking at these too late. I don't know. Somebody asked about assisted living or memory care residents being required to quarantine for 14 days following discharge from hospital or rehab. I think that's dependent on your community policy, but is recommended and based on, I believe, CDC guidance. And as far as I know, many of our communities are doing that. Any other questions?
I saw the one, I think about Austin, it must have been about Austin, about incentives for not sharing staff. Have we heard anything about that? And I don't know any specific incentives that are being put forth.
No, I'm not aware of any type of incentive. I assume it would be some type of monetary incentive, and I'm not aware of that. I can follow up. I don't see that anywhere. It was Austin specific.
Yeah.
I'll definitely look through the chat after this call and follow up with members that had any questions we failed to touch on, or I'm happy to kind of walk through them one more time, and I'll individually follow up with members with any issues or concerns.
Yeah, I think the last one from Cheryl is one, basically for the group. Are there any creative staffing solutions that people are doing given the situation, and particularly if you have to lose staff because they've tested positive and have to quarantine. Is there any specific strategies you're using for your staff, remaining staff? Sounds like everyone is struggling with it. All right.
Deidre
Well,
just, oh,
go ahead, Corey.
Deidre just put a note, maybe meant for the group. It said, have you called surgery centers or hospitals to determine if they have staff not being used?
Mm-hmm.
Oh, that's interesting.
Mm-hmm.
Okay. We're getting close to time here, so I'm going to
Oh, there
turn
was
over
one
to,
more here.
oh, you got another one?
Yeah, and I did have this on my list, but didn't want to speak too soon on this issue. So for other levels of care, non-nursing facilities, currently, you know, the state is also restricting visitation and assisted living. But we have been talking to HHSC for more details around, well, we've been requesting more guidance on potential visitation, particularly in assisted living, something that, you know, takes into consideration social distancing, adequate PPE. We've asked the agency to seek a happy medium for that type of visitation. So that is something we're working on, but no additional protocols available at this time. I know members, I think last week, shared some things they were doing to connect residents and families. So I don't know if we can put together a resource for members, but I don't have anything in writing to share at this time.
Okay. All right. Thank you, Elise. Let's move on to PPE, the latest. Anne?
Yeah, I did want to share with everyone today that from Value First, there is a supplier for a temperature kiosk. You may have seen this come out directly from Value First, but it's through Insight. And as you look forward to reopening in the future, that might be an option instead of the infrared thermometers. Also, American Knits, you may have heard of them through our Value First as well. They had a reusable mask for your ILs. They're now producing isolation gowns, so reusable isolation gowns. So I wanted to bring that to your attention as well. That's going out on the PPE alert that is going out now, I believe. Also in that PPE alert, there are sources for surgical masks, additional gowns, additional reusable gowns, KN95s, gloves, hand sanitizer. And I did want to point out that one of those sources that we announced previously, ASP Global, they have a really aggressive price point on their isolation gowns. So please do take a look at that. And also I wanted to thank a few of our communities. Christian Care has been there from the very beginning, helping me vet some of these offerings. Buckner has been great. MRC has been wonderful as well. Juliet Fowler also sent me some additional resources. And Yasar from the Wesleyan has really been helpful in identifying a source for an N95 mask, which is kind of elusive right now. So I wanted to communicate that. Most of these PPE sources have been vetted by our community. So if there isn't if I haven't mentioned something today that you need, please reach out to me directly and I'll be happy to go on the hunt for it for you.
Okay, thank you, Anne. All right, Michelle, did you have any thoughts from a risk management perspective you want to share with the group?
Well, I will point out a couple of the members have already written this in here, and Diana did, that the state is advising against the outside visits. And so for those of you in assisted living or nursing facilities that are thinking about that, that's not the current advice. And I will say that we are working on a risk acknowledgement. Some of the states have actually offered immunity, or the governors have declared immunity related to COVID-19 to, prevent lawsuits, because there's no telling what kind of lawsuits could come out of this that the insurance companies just weren't designed to handle, and neither were you. So Texas has not, to my knowledge. I know both LeadingAge and THCA and other groups have pushed for that, but have not gotten it. That said, I did have a member of our team create a risk acknowledgement. I'm going to have that reviewed by Corey, and if Corey gives it a blessing, we'll make that available to you guys. Just like you inform people when they come in that you can't 100% prevent falls, or you can't guarantee that they won't have skin breakdown. You really can't guarantee that they won't, in some, pick up COVID-19. It's an epidemic. It's not something, it's a pandemic. It's not something that you can 100% guarantee they won't have. So anyway, that's in the works, and once it's available, we'll make it available to you.
All right, thank you, Michelle. Yeah, on the liability waiver front, yeah, we've been pushing pretty hard on that. What we did learn was that the governor, lieutenant governor, sent a letter to the Texas congressional delegation, or to the leadership of the U.S. Congress, urging them to pass legislation. And the last I heard was that the House had actually, the latest stimulus package that they passed last Friday, the Senate version is going to have a liability waiver in there. So that'll be a negotiating point, and who knows where that's going to end up. But frankly, I'm a little surprised that the governor has not issued a liability waiver. Several other states have, and just not sure why it's not happened here. But, all right. Okay, well, anyway, I want to thank all of you for joining us today on our weekly call. I think next week we're going to have a treat for you. We're going to talk with several members about how they're dealing with the situation and testing and protocols and all that. So you'll be hearing more about that in the coming days. So for the RG folks, I want you to stay on the line for that meeting. But otherwise, look forward to seeing and hearing most of you this Thursday at our virtual conference. So make sure you register for that, and hope you have a great day. Thanks.